Ruth Mbao says her husband's hands became limp about a year ago. The condition of his body and his mind has deteriorated ever since. Doctors at this hospital say he has a neuropsychiatric condition, but they don't know what it is. Ruth struggles to afford the hospital fees and medicines, none of which have worked.
I need my husband to recover so he can work and my children can go back to school. You can only survive when your husband is working.
The hospital in Kinshasa has been their home for a month. It's one of only 6 mental health hospitals in Congo and the only outpatient facility in a country of nearly 70 million people. Everyone here has to pay for services. The director told us he's desperate for resources.
The difficulty is money. Most people don't have enough money for their health care, only those who have insurance. Also, the drugs are expensive, so it's not available to everybody.
This is a secure facility and the building's not in good condition. The gates here are kept chained shut. There are about 13 people living inside, but they're better off than many others in remote rural areas. Often, if families are not able to look after a relative who has a mental health disorder, they're left with little choice but to tie them to a tree.
Of course, it's
The kind of horrors that Nadine Wouters says she was determined to avoid for her son Daniel. She recently moved back to Congo after living in London for nearly 20 years. Daniel's 9 years old and he has autism. He attended a special needs school in the UK. Nadine says when she arrived in Kinshasa, she found nothing like it. So she opened one. In its first year, it's grown from 6 children to more than 40. Daniel's stopped needing to wear nappies since being here. Nadine says all the children show improvement. But she says because of stigma, many parents are reluctant to bring their children until they understand the benefits.
Most of parents keep the kid like that in the room and lock the door. Can you imagine that? That's why I don't have shame to tell another parent, I have a kid like that, bring the kids. He's a human being.
Fees start at $600 a term, so it's only Kinshasa's wealthier families that can afford it. Nadine says she's met about 200 families that can't. She's looking for funding to open another school for them. Until then, those lucky and wealthy enough to come here are already reaping the benefits. Malcolm Webb, Al Jazeera, Kinshasa in the Democratic Republic of Congo.